The work session is an opportunity for board members to discuss issues informally with staff and invited guests. The board encourages members of the public to attend work sessions and listen to the discussion, but there is generally no opportunity for public comment. Members of the public wishing to address the board are welcome to do so during the board's regularly scheduled meetings, and we will have one directly after this work session. The formal agenda is presented to everybody. Everybody have an opportunity to review. Any discussion? Commissioner Thompson?
Thank you, Mr. Chair. As I looked at this agenda and I saw that we had a fairly light business agenda, I would hope that our consent calendar could move items 7, 8, 9, 10, 11, 12, and 13 into the business meeting. I'm not looking to have an endless board discussion, but I'd like us to briefly highlight those items. It occurs to me they deal with mental health, public safety, housing, homelessness, all issues of great concern to us. And rather than have us just pass them without further discussion on the consent calendar, I sir would like to have those items 7 through 13 moved to the business agenda.
Commissioner Webb?
Yes, I noticed, I talked with the county manager earlier this week about several of those items also, and I think he has now scheduled the sheriff to come to talk to us about these items. Don, am I correct?
Commissioner Webb, members of the board, yes, on March 9th, we have the sheriff and Lieutenant Hanthorne that we're going to come and give an overview of the community corrections program and all the different elements to it, which were a large part of the consent agenda this evening.
Okay, we've got a request just to move the items from the consent calendar to the business agenda. Does anybody else have any objection, any discussion? Items 7 through 13. Commissioner Webb?
Yeah, I guess I was just suggesting that I think that wouldn't be necessary to do tonight because the sheriff is going to be here in person in a month or so in order to talk about these programs.
Thank you, Commissioner Webb. Commissioner Thompson?
Thank you, Commissioner Webb. I appreciate that clarification. However, I would like community members to notice the correction plan. I want us to look at that a little more. I am particularly concerned about item 13, Clatsop Behavioral Healthcare Provider Agreement. I want that examined in much more extensive detail. As I read our board packet, I saw either 38 or 42 service items. I don't know about any other commissioners, but I'm really eager to hear much more about those programs. And I want to hear, if I could, a summary of those program elements, the number of clients served and the number of hours of services by month as we go forward through the biennium. As you know, the Board of Public Health, I feel as a member of the Board of Public Health, I feel a real responsibility to look at the most vulnerable members of our community and to get really pertinent and timely updates as to what's going on with the services being provided to them. So if the other commissioners don't want to include items 7, 8, 9, 10, I mean, ARPA Act funding, I mean, I just think these are highly significant. 7, 8, 9, 10, I'd wait for the sheriff to talk about those, but 11, 12, and 13, or 11 and 13, I'd like to have a further discussion by the members of the governing body tonight on those.
You're muted, Chair.
Oh, sorry about that. No, this was something that we discussed months ago. If we had items that we wanted to put on the business agenda and discuss more fully, that we would do so. So and when we get to the regular meeting, we can make that motion to pull, or I guess move items 11 and 13 to the business agenda if the commission agrees. Commissioner Toyoka.
Well, kind of segues into my commissioner liaison report for later, but so just one of the things that I wanted to highlight was just we're talking about planning commission, appointments and, working on our plan and, just everything is kind of congealing at this point. I would like to have discussion further, especially with the ARPA funds and, maybe our veteran services officer, our sheriff, county manager involved as far as, let's discuss further about the micro home sites we had, a real solution-based plan for homeless instead of, a Band-Aid or an enabling programs. Work on like, the micro homes, just work on true resolution and, let's kind of try to find some solutions as we work through this. So if we do bring this back in the business meeting, I'd like to see, our veteran services officer, our sheriff, all those other parties involved in the discussion, and then we can really have some pertinent information along with our discussion. Thank you.
Thank you, Commissioner Toyoka. Yeah, that is one of the considerations is that we don't have our veteran service officer. We don't have Amy Baker here to respond to these items. So we might have to postpone to a later date if we want to actually have a report out from each of these individuals. Commissioner Thomas.
Thank you, sir. I appreciate that that we may not have all of the staff involved. I'm eager for the members of the governing body to talk about what do we want as the governing body and the mental health board. What do we want to see from our provider in terms of timely updates? Because I think we've been asking for that for a long time, but I'll confess to having lacked specificity in my requests. So I think our discussion is what I'm concerned about. And I'm not looking for Amy Baker to be here to be able to respond to the request, but I'd like us to get more clear on the request. Now, if that's more appropriate for a work session than a commission meeting, perhaps, but we're getting pretty blocked up for work sessions. And so we have time available tonight. And I'd like us to think about those. I'd like us to discuss those together. That's what I'd like. Thank you.
Thank you, Commissioner Thompson. I don't have any objection to moving them to the business agenda and then having some further discussion on both of those items. Items 11 and 13 in particular. Okay, when we go to approve the agenda, then we will, during the regular meeting, we will go ahead and make the motion to move those items. Any other comments on the agenda? Well, we have one item on our formal or our work session, but I would like to actually start our work session. We have our public health director, Margot Lalich, here. I think it's appropriate to have an update on public health and where we're at within the county right now. So I'll turn it to Margot Lalich.
Thank you, Chair Quayla. Good evening, commissioners. Happy to provide you with an update. And I'm going to sort of follow the same routine that I've done otherwise and then add some of the additional information or changes that have come through since the end of last week. We continue to vaccinate and we have a very targeted outreach right now to any of our group homes that have not received boosters to date, as well as our DD population. So that conversation is happening and staff are being assigned to reach those. It's not as simple as just showing up with vaccines and vaccinating. And so we are making sure that we are doing our due diligence. They're getting the right vaccines and that the right people are consenting on behalf of some of those individuals. Another part of that with that particular population is that they will be included in our first distribution of at-home test kits for both the staff and the population, and I'll speak a little bit more to that later. We have held 10 outreach clinics for the pediatric population. The goal in the state, and even when at the federal government, when they were talking about, that first sort of wave of the pediatric population opting to be vaccinated, the goal and hope was that it would be maybe 30–35%. We're not so fortunate in our county, but we're also not alone, although the response has been fairly predictable. We had those parents and families who are very eager to get their children vaccinated, whether it's with COVID or our routine immunizations. And so those clinics were very busy. We would have 300+ kids show up for those clinics. And then we had those who were waiting and seeing, just like in the adult population. And some have opted not to get vaccinated. Others have said, I feel like it's safe. I'm going to get my children vaccinated. And so we've included them. And then there are those, and I'm sympathetic to them, that have uncertainty because there have been so many changes around guidance. While it's based on evidence, and of course there's lots of new information presenting every time there's a change in the coronavirus, the variants, it's created a level of uncertainty, more uncertainty than certainty. And there's just that change fatigue. And then the other part of it is with the rapid authorization of vaccines, it's also created a little bit of uncertainty and discomfort. So we continue to answer questions, whether it's at the PIC, we get calls still from parents, family members, and we do continue to schedule those outreach clinics. And there are some other barriers in the community, and one could consider them barriers or not, but when we go out to a community, there's preferences of where we provide vaccination clinics and where maybe it wouldn't be so welcome by the community. So we continue to meet people where they work, and they live and they play, and appreciate the diversity in our community, and we continue to vaccinate. Our numbers for that pediatric population are almost 20% for the 5 to 11-year-olds, and a little over 18% for our CPCCO, our community, our coordinated care organization. Every week I get a report from them on the vaccination status of their members, not only the pediatric population, but other high-risk members of their organization. And so it's very helpful information, and we're in communication on an ongoing basis. The PIC continues to answer a lot of calls. It had a record number of calls, as you can imagine, in the last couple of weeks. We've reassigned staff to the PIC. We have a fairly level staffing right now out there, which is fantastic. And so most of the questions are related to scheduling testing, whether or not people should get tested, and again, where they can get vaccinated. In response to that and in support of our hospital colleagues, we've also opened up our public health clinic here at the health department to all walk-in clinics 5 days a week as well. So there's plenty of opportunity for those who want to get vaccinated, as well as those who maybe are going to their medical home and can be redirected to the health department. Testing was really busy for all of us for that last week or 2 weeks. It's quieted down, and part of it is because the community is paying attention to our direction and our situation, which we're not alone in our community in terms of the supply chain issues and the reallocation of available tests to the school setting to keep our kids in school. And again, the guidance had changed in the school setting to make it more, makes it possible for students and staff to stay in school when they have exposures. So we are continue to test the highest risk populations, and some are not so happy. If they're symptomatic of something, they want to be able to go and get a test because they want to know whether or not it's COVID. And part of it for us right now as a community and beyond our community is balancing that focus on COVID and recognizing that there are many other respiratory infections that are circulating, just those wintertime infections, and that when we're sick and we're symptomatic, we should just stay home, whether or not we know we have COVID. And then again, if we know that we've been exposed to COVID, just stay home anyways, because we should be quarantining. And part of the reason we can do this is because of the behavior of the Omicron variant. So appreciate the community paying attention to all the information that's being sent out and taking that personal responsibility for their own well-being. Had a meeting with the schools today. We meet every Wednesday, and they just continue to do an amazing job. We have a great working partnership with them. And we work through a lot of what ifs. There's clarifications, but they're doing a great job of keeping kids in school and adapting to the test to stay option in the school setting, which is definitely supporting more kids staying in school as well as staff. We have a few more outbreaks going on in the community, but again, clarification on outbreaks. When an outbreak is designated, it stays open for an extended period of time, typically 30 days past the last positive test. And so every time you get a new case, that 30-day period starts over again. So in the outbreak reports, even though we have an outbreak and it says there's 10 cases or 12 cases or 13 cases, it doesn't mean they're active cases right now. It means there are that many cases associated with that outbreak, but it doesn't mean that those are new cases. So it's really important that we see those numbers, and it can become very alarming. The other thing that we really pay attention to is whether or not they're epi-linked. And this might be more information than you want, but I think it's really important at this time because so much of the cases that we're seeing are what we call sporadic. They're just here and there. You know, people have gone to visit a friend, they've gone out to dinner, they had their mask off too long, they were at home and then found out, or they were visiting family and found out after they left that a cousin actually just tested positive. So there's so many different ways of being exposed at this point in time that we may see an outbreak and see all of these cases, but it doesn't mean they're epi-linked. And epi-linked means there has to be 2 or more cases where there is that link, that common denominator that's confirmatory that this case got it from this case in the same setting. And so it's very important information. And when you look at how we move as a community and all the different places we go each day, right, from work to the grocery store, to picking up our kids to a sporting event, to our kids going to school, there's so many different ways to be exposed. Masking, there's a lot of conversation that's starting to happen at the state around masking. I think there was a hearing last Thursday, that was a 7-hour hearing related to what may happen with the governor's mask mandate. And there was another meeting, I believe it was on Monday, and how to work with that ruling in such a way that it serves its purpose, but it also acknowledges where communities are at. And so again, well, that's a conversation in our community, even with our superintendents today. masking will continue to serve a very specific purpose in certain settings. And I do know that the intent is not to have everyone continue to wear masks forever. We also have some antivirals available in the community, actually one right now, which is Paxlovid, and we work with Columbia Memorial Hospital and one of our vaccine task force members, Chris Lehman, and we just were able to send out a broadcast fax to all our providers in pharmacy today about how they can submit an order for qualifying patients to receive the Paxlovid. We don't have a lot of doses in our community. We will be getting more doses. But again, Chris Lehman has and his team have done a fantastic job working with public health to make this available to providers in the community. Finally, at-home tests, I think our allocation is in the process of being shipped. It looks like we're getting our full allocation to our community. Again, it will be distributed through our Emergency Operations Center in the same way that we are distributing the PPEs. But again, we are prioritizing those at-home tests based upon the criteria given to us through OHA. And our CBOs and other entities within the community will also be able to order at-home tests, first for staff, for continuity of operations and to protect those we serve, and then for specific client populations. So as the distribution is going out this week to local public health authorities, it looks like next week the distribution channels and the ability to order for our community-based organizations will go live, which is fantastic news. And finally, I'm working with Clatsop Community Action. The state has had a food box distribution, and it's really through OHA and one of their initiatives that's part of vaccine outreach events. They're now expanding that and making culturally specific food boxes available to community-based organizations as part of those wraparound services. And so we have a meeting tomorrow, but there will be pallets of food boxes, non-perishables, that will be distributed to Clatsop County, and it will be managed by Clatsop Community Action, but another way for food supports to be provided to those who most need it. So that's a wonderful addition to our community and the community supports. Bit of a long update, but I haven't, I think, provided one in a little while. So I think I've covered everything and happy to answer any questions.
Any questions for our Public Health Director? I just would much appreciate all you're doing, obviously, with the Public Information Call Center, with vaccines, outreach to schools, outreach to the vulnerable communities, you know, guidance to employers, employees, and the testing. I mean, that is a lot that our public health department is engaged in, and you guys are doing it valiantly and expertly. And we had a EOC that was open to all of our caregivers here at the hospital last Friday, and Margot participated in that, answered questions that many of our employees here at the hospital had, and we came away with that just admiring how much Margot has done, and also how fortunate we are to have Margot as our public health director. It's just been a real I know a big slog for so many in the department, but we're just very thankful for all you're doing, and please pass on to everyone in the public health. And I think it's good to make that distinction about community spread and sporadic cases, because that is the case in so many of our businesses and organizations right now. It's you know, community spread is everywhere, and certainly, you know, these aren't necessarily linked to each other. It's just sporadic, and that's just the nature of the Omicron variant. Any other comments, questions? Commissioner Toyoka?
Yes, thank you. So, Margot, appreciate all the work you and your staff do, very much so. With all the different media outlets and all that, all the differing opinions, it's really refreshing to have a very consistent, factual source of information from you and your staff. So, I really appreciate that. Question I have is a lot of the teachers are outreaching, and school boards are saying you have to have the booster shot to continue working and teaching. Is that dictated at each school district, or is that, because they're getting notifications now that they have to have a booster to continue to teach, and that's kind of causing some, a little bit of unsettling, with the teachers that I've been talking to. Is that something you're discussing with those school districts?
So I appreciate hearing this because that's misinformation. There's no mandate to get a booster vaccination at this point in time. There's whether or not somebody's up to date now. It's not whether or not you're fully vaccinated or not. It's whether or not you're up to date. And so somebody can be up to date with 2 doses if it was within the last 5 months, right? So, and we talked about that today actually with the superintendents. And I don't want to speak for all of them, and I certainly can't speak for the school boards. They may choose to be considering that with their staff, but that is not a systematic requirement at this point in time. So thank you for bringing that up. I'm going to do a little bit more follow up on that one.
Thank you, Marco, because I brought it up because I was shown an email from, a couple of the teachers said, sent in and said, do I have to have this? I said, yes. If it's past 6 months, you must have it, the booster to continue. So that's why I wanted clarification.
Yeah. I
Thank
have
you.
not seen that, so thank you for that update.
Good question, Commissioner Toyoka, and thanks for the clarification. Commissioner Bangs?
I just had an ask, and I didn't know if it was even possible, but in your conversations with OHA, if we could try to seek or push for some continuity between guidelines, especially between the early learning division and K-12, but then add in the guidelines for workspace and workforce. I've faced a lot of emails and a lot of frustration from families because one child of a certain age is treated differently than another child of a certain age. And even though they go to the same school district, because our districts are now pre-K-12 in a lot of our districts, there's just a lot of frustration percolating about within our community. And so if we can, I don't even know if it's even possible, but to just broach the subject of continuity between guidelines, because it is rough on our families. And I mean, we're all kind of on edge anyway. And so it would just be beneficial to our workforce and especially to our districts and to our child care providers if we could somehow do that for them.
I agree. If we can get if the guidance can become as simple as possible and as consistent as possible, it would be most helpful for all of us, right? It's moved that. The investigative guidelines went from 47 pages down to 33. So that was like significant, really significant. And a lot of it had to do with the schools. But your point is very well taken, and we receive those calls as well. So I made a note of it, and I will follow up on that.
Any other questions, comments? Thank you again, Margot, for all you're doing. And thank you for the report. We'll move on to our item on the work session, which is the short-term rental ordinance revisions on page 4. And I'll turn it over to our Community Development Director, Gail Henriksen. Gail.
Thank you, commissioners. And if Teresa or Hannah could make me the presenter, I do have a presentation. But while we're waiting for that, I know it's been a month since we've talked about this, maybe a little bit longer. I figured there was probably some withdrawal going on with the board members, so I felt it was really important to make sure that I got back here so that we could talk about short-term rentals. We are right now in the middle of our moratorium. The board extended it through April 28th of this year. And in the meantime, we have been conducting a series of town hall meetings. And we just finished our third one this past Saturday on January 22nd. And I want to thank all the board members who were able to attend or who were able to follow up and listen to the videos, because I know that was a big investment of time and effort on your part. So thank you. So when we started the moratorium, staff was basically tasked with a few things from the board. We operate under 2 ordinances right now. We were asked if we could to find a way to bring those ordinances together and merge them. And then that was really the primary one. So that was kind of our mission in life. So I'm going to start out, and since we're a little bit condensed on time today, I want to just start out talking a little bit about the difference between licensing and zoning. Right now, we have, as I said, our 2 ordinances. We have in our zoning code, the Arch Cape short-term rental ordinance and all their development standards. And then in our Clatsop County Code in Section 5, we have business operating standards for short-term rentals and all of the rest of the county. And so it's important that we keep this in the back of our heads, because when we did our ordinance in 2018 that addressed short-term rentals in the rest of the county, we didn't address the zoning issues in our zoning code. So while we say it's permitted in Arch Cape in our zoning code, we don't address it anywhere else, and that's causing some confusion, and there's a big lack of clarity there. So during our 3 town hall meetings, which we had back in September, November, and then again this past Saturday, we were primarily focused on a lot of the operating standards that are in the county code. And you can find all of our recommendations in attachment A in your agenda package, which begins on page 8. But briefly, I just wanted to go through them and kind of give you a summary of the recommendations that staff is putting forward this evening. One would be to have all parking for STRs be provided on site. We would like to institute a good neighbor program and a flyer that would be required to be posted in all of the short-term rentals. And the one that we have put forward in your agenda package tonight as a draft is based on the one that Tillamook County uses. And so there's addresses things obviously like quiet hours and parking, garbage, being sure to obey the speed limit in your neighborhood. But I think we would also want to look as well at some information about open fires and burning, when and where you can use fireworks, things like trespassing, pet control, and some of the other issues that we're hearing about through the complaint process. We have talked at length at different occasions about whether or not permits should be able to be transferred. Staff is recommending that we do not allow the transfer of permits. And then in terms of how long a permit would be good for, currently those permits are good for 5 years. Staff is recommending that be reduced down to 2 years. We would still recommend that the fee remain at $550 for that 2-year permit. And I didn't include it in this presentation tonight, but in previous presentations, I've had a table that shows the different fees for the permits around the county in the various jurisdictions and in adjacent counties and jurisdictions. And that $550 for a 2-year permit would put us pretty much in the middle. We wouldn't be the highest, we wouldn't be the lowest. So it kind of puts us at a median area. Staff is recommending some changes to occupancy. One important change would be to base occupancy upon the septic capacity on the subject property, or to have it based, if you're attached to a sewer, you could have it an average of 2 persons per sleeping room up to a maximum of 14 persons. And that would be a change that would be consistent with our Arch Cape ordinance, but is a reduction in terms of the maximum occupancy allowed in our Ordinance 1801, which doesn't really have a maximum. It's just based on number of rooms. We also have are recommending that the Arch Cape Ordinance language that would limit rentals to no more than one rental every 7 days be included in our current ordinance in the county code. And we've made several recommended changes in how we process complaints and violations and potential penalties. And we're recommending that we create a tiered system that would be based upon the priority and severity of the complaint. So life safety issues and violations, which is really what this ordinance was originally intended to address, would be the highest priority and would have potentially the most stringent penalties if it was determined that there actually had been a violation. So I'm going to stop here just to see if there's any comments or questions from your board on these recommendations so far.
Not seeing any.
Okay. So we had a couple of more recommendations. We have had concerns raised during the public input process about unsubstantiated complaints. And when we put our data together and looked at complaints for short-term rentals, we did find that there were 17 that we were unable as staff to verify that there had a violation had actually occurred. So we did put some language in there that says if someone knowingly files a false complaint, then we would create a citation section that would basically be like a $50 fine, and you would be fined for submitting false information. We have in your agenda packet some recommended language about the local agent and representative, and this is the person who, if I as an owner of a short-term rental are not available, you are my contact person on the ground. You are my eyes and ears and my feet. And so we had initially included some language, which is in your packet, but after our town hall discussion on January 22nd, I think that staff is recommending that we would create a tiered response time that would match the tiered violation level. So if you had a life safety violation, you would have probably a 30-minute response time. But if your violation is the garbage can is cracked open and garbage pickup isn't until Monday, that probably doesn't need a 30-minute response time. Maybe that could be responded to within 24 hours. So we're going to be looking at doing some changes to that. We had also included in your agenda package some possible other recommendations, and I've summarized here what we would be recommending be included and what we decided after our town hall meeting probably didn't need to be in the ordinance. So I will stop here again and see if there's any questions or comments about these additional recommendations.
Commissioner Tom.
Well, thank you, Mr. Chair. So if we're talking about emergency information regarding power outages and landslides in addition to tsunamis, how about wildfires as well? Thank you.
I can certainly add that in.
And Commissioner Webb.
Yeah, thank you. I have a question about the outdoor signage requirements. Are you recommending, Gail, that we no longer or that we don't include outdoor signage requirements?
Yeah, we do not have a requirement right now, Commissioner Webb, for outdoor signage. And as staff went through some of the survey ordinances that we reviewed, many of the jurisdictions did have a requirement that there be a sign visible from the public right-of-way that would have contact information for that particular short-term rental. And that was one of the things that was in our presentation on Saturday, that this should be considered for being added to our current ordinance. And there was a lot of discussion about it and a lot of concerns that it did make it feel more less residential in nature if you started putting all these signs out front. A lot of people encourage the county, rather than a sign, to make this information available on our website, so it's available 24/7. Cannon Beach and Gearhart both do that as well. They have the contact information listed on their city's websites. So based on that, to answer your question, I'm sorry, based on that, we decided as staff to not recommend including an outdoor signage requirement.
Okay, you said that you had talked about an outdoor signage requirement in the right of way?
No. So the sign itself wouldn't be in the right of way. It would be on the rental property, but it would have to be in a position that would be visible to someone on the right of way. So if I wanted to get the contact info, I'm not trying to look at a sheet of paper that's pasted in somebody's window and get the phone number. Yeah.
Okay. I understand that, but I can tell you that having sat on the Housing Authority for 3 years now, when we have issues that come up, recently, for instance, in one of our apartment complexes in Seaside, we had basically a sewage backup that impacted a lot of the property. And there was a dispute about whether, who knows who to call in emergencies. And I just wondered, to me, there's really, I'm not sure, especially on some of our rentals that are on larger lots, that having somebody stand in the right of way and be able to see a sign might be cause for an awfully big sign. But at the same time, it just seems to me that in the cases of physical emergencies, sewage backups or other issues, that other than calling 911, how would people know what to do? So I'm not sure that I agree with not having something that that is a fairly large indication, in a window. Perhaps in the front facing the right of way. I don't know. I know that this can be something that really does demand immediate response. That's all.
Any other comments, questions? Okay, Gail?
Okay. So then I wanted to talk a little bit about zoning, which we brought up at the beginning of our conversation. And why do we even care? I mean, we keep hearing it should be in our zoning code. So zoning is the way that we identify the geographic areas in the county where we allow specific types of use. And then the zoning code also establishes the type of procedure we use to review and approve an application. And we do have language in our zoning code that says a structure has to be used or developed as permitted in the ordinance. And I'm paraphrased there. So if you remember, we have short-term rentals called out as a permitted use in the Arch Cape zoning district. And again, when we adopted Ordinance 1801, going on 4 years ago now, we didn't go through our zoning code and do the corresponding work to update our zoning code to also include short-term rentals. And as I said earlier, this has caused a lot of confusion. We need to rectify the situation in order to improve our clarity in the code. And we do have leeway with this. So I know I've talked a lot in the past about farm and forest zones, and I keep telling you, no, you can't do that. And no, state statute says we can't do that. But here we have a lot of flexibility. And so your board can determine, for example, what type of procedure to use. You can do it as a type 1, which is basically an over-the-counter permit, does not require public notice or a public hearing. And you can move up the scale from there all the way to a type 2A, which would require a public hearing. We'd put a sign on the property, we'd put an ad in the paper, and we'd send out public notice. So you do have some flexibility in there. in Arch Cape right now, it is a type 1, and it has been since 2003. It's basically an over-the-counter permit. You show me that you live in the correct zoning district, your house doesn't have violations, you can put the parking on the property, we give you a permit. So when we met on Saturday, staff put out, just as a starting point for discussion, 6 potential options to try and address the zoning issue. And there obviously wasn't a lot of middle ground, really no consensus to speak of. And so staff is just going to go forward and throw a recommendation out for the board's consideration. And we are recommending a slightly modified version of option 6, which is shown on page 48 of your agenda package. And basically what that would do is we would amend our zoning code to list short-term rentals as a type 1 use. So over-the-counter permit, no public notice, no public hearing, in all of the zones where we allow a single family dwelling. And that basically puts us, makes us consistent with what is happening in Arch Cape right now and would happen all throughout the county. Now, if the board wants to, and you could decide that in certain areas of the county that maybe a higher level of review is needed, and maybe there should be public notice, or maybe there should be a public hearing. But you have the ability as the board to do that on a zone by zone basis. It's not an all or nothing concept. So if you think more scrutiny is needed in one area of the county or in a particular geographic area, you can do that. And then we can make less stringent review in other areas of the county where maybe we don't receive as many complaints, or the properties are larger and there's less, fewer short-term rentals. So you do have options as your board there. The second recommendation would be to remove from the zoning code the operating standards for the Arch Cape short-term rentals and remove reference to them, and instead require all of the short-term rentals in the county to operate under the operating standards that would be in our Clatsop County code. And then we would amend that code to include the recommended revisions that I just talked about a few minutes ago. I do want to let the board know, though, that we have been informed by our land use council that we cannot have short-term rental units in farm and forest zones. And that's because state statute spells out the list of uses that are permitted in those farm and forest zones, and short-term rental is not one of them. So until such time as the state changes that rule, just know that farm and forest zones would not be eligible for short-term rentals. So I will stop there and pause for questions and comments.
Thank you, Mr. Chair. Well, I have the position of being both a neighbor and a county commissioner. And it's a very interesting dynamic because as a neighbor, I was very concerned about the impact I saw in my neighborhood beginning, bought the house in 1999, began to live there full time in 2004, noticed with the advent of the internet, a lot more people in the neighborhood. And some of them were amiable, some of them were respectful, and some, not so much. I would have to say drunken, disorderly, and profane. So there was a whole range of people. What occurs to me is that we've got zoning, which is about laws. We also have interpersonal relationships. And what I've seen is interpersonal relationships get played out as if they are matters of law. It's interpersonal relationships. So whether it's the sheriff's office, the code compliance officer, the county commissioner, it doesn't matter. If people have interpersonal conflicts that they're not able to resolve, the law gets dragged in. So when I look at this proposal from staff, I say to myself, how do we make the best use of taxpayer dollars to encourage individuals whenever and however possible to resolve their interpersonal conflicts and not involve law enforcement, civil or criminal or any of it, in that in that interaction. So that's what I'm thinking about. Thank you, Mr. Chair.
Thank you, Commissioner Thompson. Commissioner Bangs?
Oh, I'm looking at the packet, and on page 5, you have 6 listed options that you wanted, that staff had prepared for consideration. And as I'm looking at it, I'm also hearing from my own personal constituents that live off 202 and 30 who do have STRs and are very concerned about the potential overregulation that could be occurring in their area. And what I think is that I'd like to minimize county's impacts on areas that haven't expressed concern. We have one primary area that has an abundance of expressed concern. And so my thought process is number 5, extend the Arch Cape STR requirements to include Cove Beach and resident or coastal residential CR zones. Add STRs with an occupancy of 6 or fewer renters as permitted use to the CR zone. Renter applications for occupancy exceeding 6 renters would be processed as a type 2 conditional use. Apply Ordinance 1904 with proposed revisions to the remainder of the unincorporated. I just want a minimalistic approach when in consideration to the rest of unincorporated Clatsop County. When we are looking at Cove Beach and surrounding area, and they are already so close to Arch Cape, pulling that boundary out to encompass them just seems logical after reading all of the Arch Cape's current things that they have within their regulatory use or their regulations. And I don't know, I personally would like to prevent the county from encroaching upon landowners outside of the zone of concern. Especially when I have landowners off 202 that have called me regularly wondering what is going on and why is there a concern, because they haven't had one up until this point. And so those are just my thoughts.
Thank you, Commissioner Bangs. Any other comments, Commissioner?
I'd like to support Commissioner Bangs's comments. I think that there is so much of the rest of the county that is not at all like the southwest corner. And I think that there are issues that we can adapt for the rest of the county. I think now I have attended all of the public meetings, etc. There were only a handful of folks who came forward who did not live in the southwest corner of the county. I can well understand the concerns in the Southwest. I really can. There were some awfully compelling stories told, but it's also a much higher density. And I think that going with kind of the general issue that a lot of citizens seem to be pretty happy with the Arch Cape regulations and talk about them having worked very well over a long period of time. So I really support the idea of just extending that line to the Tillamook County line and having a special part of the code that deals with that. And so, but in the rest of the county, you know, to me, the whole idea, for instance, I mean, the staff went into great consideration of you know, a type 1 versus a type 2. Do you have to notify neighbors within 100 feet or 300 feet? When you're not dealing in a densely populated area, perhaps there are other considerations that have to be addressed. I'm always worried about the septic issues, for instance. And so I think maybe it's time for us to kind of well, that's not the right word, to perhaps segment our code to the southwest corner and then the rest of the county. And perhaps then we could actually take a closer look at the rest of the county and make sure that we are doing the right things for them. And perhaps open up more of a comment period for people who don't live in the southwest corner. And I also have a question. I know that the staff has done an incredible amount of research on this. Have you all run into anything, Gail, that talks about the idea of what percentage of housing units are appropriate to be short-term rentals? I just wonder if there is anything in your research that speaks to that.
There is nothing in my research, Commissioner Webb, but I did not dig too deeply for that. I was based more on the operational standards.
Sure. Okay, thank you. I just wondered if you'd run into that. Thank you.
Thank you, Commissioner Webb. Any other comments, questions? Commissioner Thompson?
Thank you. I deliberately held back to hear what my colleagues had to say. I'm pretty sure that no matter what we decide, that someone will be unhappy and maybe everyone will be a little bit unhappy. That's often considered to be the mark of a good solution, is that nobody's completely content and nobody is completely dissatisfied with it. I think what we are looking for is a solution that will help people interact peacefully in their neighborhoods, to have reasonable constraints on activity, and most of all, to have productive and positive communication between all kinds of neighbors, whether they're permanent or temporary, however that goes. I hope that what we do achieves that end. Thank you.
Thank you, Commissioner Thompson. Commissioner Toyoka?
Yes, just a question for Director Henriksen. It's like, I've read the packet, and unfortunately I did not attend Saturday's meeting, but we have previous discussions. We've talked about water, septic, emergency services. Has there already been discussion about incorporation for that area to provide those level services and have some more autonomy in terms of the short-term rental?
I believe Commissioner Thompson has mentioned it several times as a potential option. Staff has not broached the subject, though.
Commissioner Thompson?
Thank you. And staff has not. I have repeatedly, because what I'm looking for is responsible empowerment for my neighbors. How do we have the most capacity to solve our neighborhood differences of opinion, or our standards, or our expectations? How do we do that? And I think having the appropriate legal foundation is the best way to have a successful end product. So I continue to think that with the increasing level of urbanization that we're seeing in, are we the southwest corner of the upper left edge? Our part of the county, we are increasingly densely populated. And what is the best way? I think it's time for a community conversation that looks at legal alternatives. That's my opinion. Thank you.
Thank you, Commissioner Thompson. I think this is a good segue to County Council. We've got 2 minutes before our regular session, but I'll turn it over to County Council.
Chair Quila and commissioners, can you hear me? No, you cannot hear me.
You're really soft. Can't hear you. No, I'm sorry, County Council, we just can't hear you. Well, I think that we've had some good discussion. I like the suggestions. I like Commissioner Webb's suggestions about extending the boundary. And I think that Commissioner Toyoka and Commissioner Thompson both bring up good points about exploring the feasibility of incorporation. I think that those are some certain things that we should be looking towards? What are our next steps, Gail?
Okay, so if there's a general consensus with option 5, where we just extend that boundary, I'm looking for affirmation. Okay, thank you.
Yes.
So our next steps then, we will bring the revisions to the Clatsop County Code, the operating standards, to you in February for 2 public hearings. We will take the code amendments to extend that boundary to the Planning Commission in March, because as a zoning ordinance amendment, it goes to the Planning Commission first. And then those Planning Commission recommendations will come to your board for 2 hearings in April, and we will finish, if all goes well, on April 27th, the day before our moratorium expires. So.
Great, thank you. I see that County Council's question about the same code operating requirements. Is this something that we would like to do, same code operating requirements? And it's that what we just discussed there, Gail?
So it would be a little bit different. If we just include the Arch Cape short-term ordinance standards and pull it down to Falcon Cove, we will still operate under 2 operating ordinances. Or we can just pull the boundary down, but that doesn't really address that. Sorry, I'm thinking out loud because I didn't anticipate the question. But no, we would still operate under 2 ordinances, and that would be the way that it would work.
Okay. I saw Commissioner had a question.
Well, I think my question kind of falls in along these lines. I wanted to make sure that we were resolving any code issues that we had by just extending that line. So.
Yes. So I'm sorry, I don't mean to take up your time. I can discuss this with County Council. Is the board's preference, is your preference to have the 1 operating ordinance, or did you want the 2 operating ordinances?
I think my main concern is I don't want the impacts of change to stretch outside of the area of concern. Because right now, all other short-term rentals, from every feedback that I've had, there are no concerns outside of this area. So if we just pull it down, do we resolve issues? I don't know if it is the end of the day. I don't know if I'm projecting my thoughts correctly.
No, I completely understand your question, Commissioner Bangs. I just hadn't anticipated the question, and I want to think it through before I give a definitive answer. So.
And that's fair. Commissioner Thompson, you had something, and we do have to move into the regular session soon here. Okay. We will be taking this up again. Thank you, Gail. Appreciate the presentation and very good discussion and suggestions.
Thank you.
With that, we will go ahead and move from our work session to the regular session. And I think Teresa's with us. The Board of Commissioners, as the governing body of Clatsop County, all Clatsop County service districts for which this body so acts, is now meeting in regular session. Teresa, can we have the roll call?
Yes, Chair Quila.
Here.
Vice Chair Thompson.
I'm here.
Commissioner Toyoka.
Here.
Commissioner Webb.
Here?
Commissioner Banks.
Here.
Okay, we had some discussion about the agenda during our work session. We discussed about moving items 11 and 13 to the business agenda from the consent calendar. With that, do we have a motion to approve the agenda with those changes?
Mr. Chair, I move to adopt the amended agenda, moving items 11 and 13 to the business agenda from the consent agenda.
We have a second.
I will second.
Moved and seconded to approve the agenda with those changes and moving items 11 and 13 to the business agenda from the consent calendar. All those in favor signify with an aye. Aye. All those opposed?
Could I
Nay.
Okay,
have a
motion,
little,
okay, motion carries. We'll go ahead and move on to the proclamation. The proclamation is Cascadia Earthquake Awareness Day. And I'll turn
Chair
it over.
Chair Quila, I believe Commissioner Banks wanted to speak. I'm sorry.
Oh, sure. Commissioner Banks, did you want to, going back to
just-
the agenda?
I just wanted a little discussion prior to the vote, is all. I just wanted to discuss the motion prior to the vote.
Okay, my apologies.
That's
did I
okay.
put it there. We did you vote on the agenda item? Or you didn't? Okay. Well, we did have a majority vote, and we'll go ahead, and when we get to those items, we can have the discussion. Commissioner Banks, my apologies. We'll move to the proclamation. Cascadia Earthquake Awareness Day, and Tiffany Brown, our emergency manager. I'll turn it over to you.
I'm sorry to interrupt again. I just need to clarify. So is Commissioner Banks a nay or a yay for you're a yay?
So I have one item I wanted to discuss prior to the vote. Something that I wasn't comfortable with. And so I am choosing to abstain if we're forcing a vote and calling question on it.
Okay. Thank you.
I believe when we get to the consent calendar, if there is some discussion, we can still do that. So, when we get to the consent calendar, Commissioner Banks, if you want to make a comment on it, you have that opportunity. I'll turn it over to Tiffany Brown, our emergency manager.
Good evening, commissioners, and thank you for taking time to read the Cascadia Earthquake Awareness Day proclamation tonight. Cascadia Earthquake Awareness Day has been in existence for about 3 years now. It is designed to raise awareness about the impacts and need to prepare for an impending Cascadia earthquake and tsunami on the Oregon coast. This is the first time we read the proclamation that it actually falls on the anniversary of the 1700 earthquake. Tonight at 9 o'clock will be the 322nd anniversary of an 8.7 to 9.2 earthquake that occurred and sent a tsunami onto our shores. We really only had oral tradition for about less than 300 years, but in the 1980s, scientists started to piece together the threat off of our shore. The value of the proclamation tonight is to bring this into the minds of folks. It's been a cold week. I think about what would happen if we had something happen on a night like tonight, and to encourage every citizen in the county to prepare, to look at their own personal preparedness and to increase that level of preparedness. We're most resilient as a county if every citizen can become prepared, and it makes our job easier as government to respond and use our resources in the way that benefits most broadly the community. Thank you.
Thank you, Manager Brown. And with that, we'll need a motion to
Mr.
approve the resolution. Go ahead.
I move to approve the resolution and order proclaiming January 26th, 2022 to be Cascadia Earthquake Awareness Day and authorize the chair to read, then sign the proclamation.
We have a second. Commissioner seconds. Moved and seconded to approve resolution and order proclaiming January 26, 2022 to be Cascadia Earthquake Awareness Day and authorize the chair to read, then sign the proclamation. All those in favor signify with an aye. Aye.
Aye.
All those opposed? Okay, motion carries. In the matter of proclaiming January 26, 2022 to be Cascadia Earthquake Awareness Day, whereas January 26th marks the 322nd anniversary of the last Cascadia subduction zone earthquake to impact our region, and whereas geologists have determined that major earthquake magnitudes of 8 or 9 have occurred many times in the past and could occur at any moment in the Pacific Northwest, and whereas given the lack of preparedness in the region, such a quake could create the worst natural disaster in North American history, And whereas government agencies and disaster organizations cannot bear the sole responsibility to prepare for, respond to, and recover disasters. And whereas as a community, we are increasingly recognizing this earthquake threat, but such recognition has not yet translated into a commensurate increase in our earthquake resilience. And whereas Clatsop County is also vulnerable to tsunami and residents should prepare to be self-sufficient for at least 2 weeks following a natural disaster of this magnitude. And whereas greater recognition of the earthquake threat is key to motivating action by such individuals and groups. Now therefore be it hereby resolved that the Clatsop County Board of Commissioners does hereby proclaim January 26, 2022 as Cascadia Earthquake Awareness Day in Clatsop County, and calls upon all citizens, community agencies, faith groups, and businesses to increase their efforts to encourage everyone to be prepared for the Cascadia subduction zone earthquake dated this 26th day of January 2022. And that will be signed by the Board of County Commissioners for Clatsop County and the board chair. All right, we move on. Thank you, Tiffany. We'll move to the business from the public. This is an opportunity for anyone to give a 2-minute presentation about any item on the agenda, except for public hearings or any topic of county concern that is not on the agenda. Clerk of the board, are there any members of the public registered to speak?
Yes.
If you have registered to speak, please wait until your name is called, then give your name and address for the record. You will have 2 minutes to speak. Teresa?
Nancy Chase.
Hi, thank you.
Okay.
Nancy Chase. Can you hear me?
We can't.
3026 Northeast 22nd Avenue in Portland 97212. I own 2 long-term rentals in Clatsop County and 1 short-term rental in Cove Beach. And the Arch Cape Ordinance I've studied, it seems like there are 2 unique things in it. One is a 7-night minimum, and also the no parking in the right-of-way. And I'm concerned about that all short-term rentals need to have parking. All short-term rentals park on site. I have a 2-bedroom cottage, 4 parking places, so I've got plenty of room, but I often have a neighbor's car parked, part on my lawn and part in the right-of-way, or a contractor, or people visiting the beach. So I'm just, before you drive your code enforcer crazy, he may already be with everything, but I would just really look at how enforceable is that? Who is that? How do you research who that car belongs to? And as long as there's room for emergency passage and cars to get by, is that really a problem? If it is a problem, if the road's that small, then it should be posted no parking. And that's kind of different from any responsibility of a short-term rental, because I'm sure every part-time resident parks on the street as well as full-time. So is that really an STR issue? And then the 7-night minimum, I think, is going to exclude a lot of families who can't afford that. I can fill my place in the summer, but that means, you know, I have a lot of people who have been coming for 20 years who can only afford 3 or 4 nights. So I'd like you to consider that. And then I think the new notification complaint tier system really needs to be looked at, so it's not used as a weapon to get rid of short-term rentals, because I think that's the real problem in Cove Beach is people who bought property when there were short-term rentals when they purchased, and now I think they want an exclusive community. So I think I've used my 2 minutes. I just hope you consider those items. Thank you.
Thank you, Nancy. Teresa?
Yes. John Meyer.
Yes, thank you very much. I appreciate having the opportunity to speak tonight on short-term rentals. We have a home at 31865 Clatsop Lane in Cove Beach. I want to agree with the comments that Nancy made about on-site parking. We certainly have adequate parking for our guests, but there are very often all throughout Cove Beach, contractors, landscape people, occasionally that do park in the swale. And I don't think the regs are very clear on this. And so I would encourage more clarity as to what that really means. I also agree with Nancy. I'm concerned about the 7-day requirement. We have many guests that can just afford to come for the weekend and come because their children are in school. This is obviously more problematic in the off season, but it's also a question of affordability. And I think that's important. We're also concerned about the loss of the transferability of our permit. We and many other homeowners purchased their homes recognizing that it was licensed and did have a permit, and that we were, of course, obligated to have it reviewed and have it inspected, which we did. So we're certainly concerned about the loss of, and the representation when we purchased our home that the permit could be transferred with it, and are concerned about taking that property right away. But otherwise, thank you very much for this evening and all your efforts. And I want to especially thank staff for everything that they've done to pull this all together. Thank you.
Thank you for your comments. Teresa?
Thank you. Charles Dice.
Charles?
This Charles Dice. I live at 31911 Clatsop Lane in Cove Beach. And I'd like to just say a couple of things. One is that the zoning regulations for the coastal residential zone, which includes Cove Beach, have always not permitted vacation homes. That was never a permitted use. There may have been houses that were used for that purpose, kind of, under the radar in years past, but certainly they never were permitted to use it because it was against the code. That all changed in 2018 when the STR ordinance was passed and short-term rental permits started getting issued to folks down here in Cove Beach and in the coastal residential zone. And you already have 2 legal letters that I think explain why that was a violation of the code. Cove Beach is a lot different than Arch Cape for a whole number of reasons. And I'd invite any of the commissioners to come down here and take a look, and maybe they would understand it a bit better. But the other thing about Arch Cape is that Arch Cape, back in 2004, when they developed their own STR code, or their own vacation rental code, they had their own design review board that did this for the community. So the community participated in the development of those ordinances, and they were all happy with those ordinances, and that's why you don't have problems in Arch Cape, or not nearly as many. And whereas in Cove Beach now, since 2018, we have 30% of the homes here that are now being used for short-term rentals, and it's absolutely destroying this residential neighborhood. We don't have neighbors anymore. We've got a mini hotel. So I'd really ask the board why you are crushing the citizens that live in Cove Beach and in the CR zone and destroying our residential neighborhood. Thank you.
Thank you, Charles. I would remind folks, if you're not speaking, to make sure you're muting yourself. Thank you.
That's all the public comment.
Okay. Thank you for the public comment this evening. We'll move on to the next item, which is the consent calendar. And I know Commissioner Bangs, you had a comment on the consent calendar. I'll turn it over.
I just hesitate to pull item 11 off of the consent calendar and push it to the business agenda, just because we haven't provided those managers of lifeboat services public notice that we would be having the discussion. And I feel that because it directly could potentially impact their nonprofit, that they should have sufficient public notice to have the discussion.
Thank you, Commissioner Banks. Commissioner Webb?
Yes, I'd kind of like to second that feeling. I think that especially since the lifeboat services issue is a bit fraught already, and that there are several partners involved in it. I think that when we publish items that we then change the agenda with, I'm just a little bit uncomfortable with that. And in terms of the CBH provider agreement, I actually talked to the county manager about maybe pulling that and putting it on the regular agenda. But I don't think we should do that kind of thing without Amy Baker being present in the discussion. And so I don't know, maybe Commissioner Thompson could clarify for us, exactly what she anticipated we would talk about.
Yeah, I'll turn it over to Commissioner Thompson, but I will remind folks, just because we're moving it to the business agenda doesn't mean that we're not going to take action on these items. Commissioner Thompson.
Thank you. Well, thank you, colleagues. What I'm looking for is a fuller discussion of how we as members of the governing body act regarding contracts like these in order to assure that people in Clatsop County are getting maximum value from these contracts. So I'm not looking to do anything except to say, you know what? I've talked for a long time about inappropriate delegation, because in terms of getting program reports as a governing body, we haven't had those. So I'm not looking to find fault with anybody. I mean, I fault myself. I didn't ask specifically for what I want, but I read through all 404 pages of this board packet. And I thought to myself, during the public hearing on Saturday, someone used the phrase victim. And that's been rattling around in my brain, because when I looked at these contracts, they are dealing, the dispossessed, the victims, the folks who are really struggling and having problems in our community. And my sense of who we are as a team, as a governing body, is that we are devoted to making sure that the people who are struggling get the best level of support. In order to do that, I think we need information. So what I wanted to talk about tonight was, what kind of information do we need from these agencies? And the reason I wanted to talk about that was I looked and I thought, okay, I don't want to make onerous program reporting. Who needs to layer service providers with paperwork and administrative red tape? No, that's not what I'm after. What I am after is some clear data that will guide us. So I saw either 32 or 42 program elements in the CBH contract. And I thought, would it be a reasonable request to say, tell us every month, CBH, in all of these, every single one of these program elements, how many clients did you serve this month? How many hours of service did you provide to them? And that's why I was thinking of the lifeboat services, the ARPA. What are we getting for the taxpayer money we're spending? And we can look at the output measures. That's a start, but we want to see the outcomes that will help us really deal with the causes and the effects, to the extent that's possible. I mean, we're not miracle workers. We can't take care of everything that isn't going well in Clatsop County. But if we have data, program reports that give us some kind of shape and form, then we can look at what outcome measures do we want? How can we support their effectiveness? How can we be effective? How can we be accountable to the voters and the taxpayers here? As Commissioner Toyoka says, we don't want to put Band-Aids on. We don't want to support or enable the wrong kinds of activity. How do we have data-supported discussions absent data? So the reason I wanted to pull them was so we could do what we're doing now, which is to talk about what kinds of data can we reasonably ask of our service providers? Because the reason we get to sign these contracts is because we're the governing body. We have to be the ones to sign this. The buck stops with us. Okay, let's see what we're getting for the buck. So that was my logic. Thank you, colleagues.
Thank you, Commissioner Thompson. Is there any other discussion on the consent calendar? Because we do have items 11 and 13 already moved to the business agenda, but Commissioner Webb.
Yeah, I'm sorry. You just clarified what we were doing. So we've already moved them. And so
We've already moved. We're not going back on what the consent calendar consists of. We actually have the consent calendar minus items 11 and 13.
Okay, thank you.
So do we have a motion to approve the consent calendar?
Since I've mucked around with the consent calendar this month, sir, I will say I move adoption of the consent calendar as amended, which is to say items 3 through 12 and items 11 and 13 move to the business agenda.
We have a second.
I'll second it.
It's been a motion and second to approve the consent calendar as amended. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. Okay, we'll move on now to the business agenda. We do have item 11. That is the American Rescue Plan Act funding agreement with Lifeboat Services on page 199. Any discussion on this? We have
Chair
had some
Cleland?
already.
Chair Cleland,
Go ahead.
Did you skip the?
Oh, I'm sorry. I'm skipping everybody's reports. I'm sorry. I will go back in time here and go to Commissioner Thompson for a liaison report.
As my mom said to me one time, that isn't the first curveball you've thrown me, you know, so sorry, sir. Well, I spent a lot of time this afternoon working with Harmony Burright, our water project, our water inventory staffer. What we're looking at is how to get data and use it in a teamwork environment. So we're looking at not only water usage, but we're looking at various points of view. My first call was to Richard Bash. I want to have Chris Nemla will come in. I want to have farmers and water, all kinds of water folks involved in this conversation. So we spent a lot of time talking about that. Congresswoman Bonamici had a town hall today, which was excellent. She talked about the American Rescue Plan, the infrastructure bill, and the Build Back Better plan. She was very interested in what we had to say. Mayor Balanceford brought up the problems that the city of Warrenton had with the levy issues. She's responsive to that and tracking it. I talked about childcare, broadband, mental health, housing, water inventory, and folks from Gearhart brought up safety and gun violence. So mental health, you know, I talk a lot about teamwork because for me, it's like customer service. If we just look at things from a customer service point of view and everybody's our customer and how do we give them the best service, that's one way to do it. How do we do teamwork together with every constituent along every dimension? It's not always possible, sometimes challenging, but if we have that teamwork perspective, I think it's useful. We're all frayed. I mean, COVID has really frayed all of us. And to that end, as part of my being co-chair of this AOC County Solutions Advisory Committee, I found out there's some mental health dollars. So Commissioner Quila, I hope you'll speak to those because I passed along an email from my co-chair, Commissioner Kramer from Wasco County, because what we're looking at is how do we get that money and get it in our community so that we can use it to support our people and deal with the housing issues, the mental health issues, the substance, all of it. So That's my report, Mr. Chair. Thank you.
Thank you, Commissioner Thompson. Commissioner Banks?
Well, my liaison report is probably pretty short. I've spent a lot of time watching our STR video and listening and reading over the last couple days. And then I had a very enjoyable childcare meeting with you here most recently. And so I feel like we're on the cusp of some good decisions moving forward in the form of childcare in our community. And yeah, I'm kind of excited to be moving STR off of our plate because I feel like it's been here a year and moving forward to other projects. So
Thank you, Commissioner Banks. Commissioner Webb?
Yes, first of all, a very exciting announcement that we have received in cooperation with the North Coast Watershed Alliance. They have actually received a grant that we endorsed for them. And I think it's a very exciting one because I feel as if when I was on the watershed, what am I trying to say? The water district. I was struck by the fact that they weren't being as aggressive as I might have liked them to be in terms of understanding the limitations of water within our county. And what this new grant is going to do is going to give the staff of the Watershed Alliance the opportunity to work closely with our GIS folks to do a little bit more specific analysis of the quality and quantity of our water, of our freshwater resources. And so I think it's pretty wonderful. The county manager was great in working with Graham Clegg about this, and I think it's going to be an exciting project that's really going to go far in terms of something I've been very concerned about, which is that we just don't have enough real data about what the situation is with our water. The other issue that I've spent some time with lately has been that there are two efforts afloat about creating hiking trails along the coast, the entire coast. And today I was in a webinar with a group that is a collaboration of AOC and the state parks folks and a few other organizations. And there are actually two efforts afoot. One of them is called, and I'm sorry, I've lost my piece of paper that I had this on, but one of them is kind of a private group that is being funded by a very wealthy Portlander about creating a hiking and biking trail a bit inland from 101 going down the coast. Then there is a government program that is being paid for mostly by the state, which is talking about the present coast trail and the fact that there are so many parts of it that are not connected, that forces hikers to take major detours to get from one point to another on the coast. And the worst part is that it often forces them to actually walk along 101 as part of the trail. And so I'd like to encourage us to maybe, first of all, be able to have our parks department folks a little bit more closely involved with some of these efforts. I don't know if they have the staff capacity to do that, but I'm certainly in it for that. because because it looks like, and actually this is part of a legislative mandate, that it looks like the state is going to be willing to put some real money into making this coastal trail happen. And so I'm going to be, I already have a call in to Andy Smith about it because he's the AOC staffer on it. But I think it's something that we really need to pay attention to. I don't know how many of you are hikers along the trail, but to me in Clatsop County, we have particular issues, starting at Fort Stevens, which is actually the beginning of the trail. And it isn't even straight within Fort Stevens, and there's not a lot of good signage. It's become an issue with our Chamber of Commerce tourism people to be able to make sure that there are proper maps about and good public information about how to access the trail and when it's dangerous and when it's not, etc. There's also a movement on the part of the state group to put more funding into what I think people call waysides that would be nighttime inn or hostel or camping opportunities for people along the trail. And to address a lot of the concerns about parking issues, because there is virtually, I don't know how many of you maybe are familiar with the Appalachian Trail, but I'm originally from Virginia and I've hiked big sections of it. And it's got wonderful examples about how to deal with providing for people who are hiking sections of the trail. Where do you park your car? Where are you going to be able to get fresh water? Where are you going to be able to spend the night? Where can you camp and where can you not camp? I think we're finally turning our attention to that. And I think it's something that we as a county really need to be involved in because we're at the beginning of the trail. We're the northern end of the trail. And so I think we have to be at the table. So I'm going to saddle up to that table.
Yeah, okay.
I think that's it for later on the agenda tonight. We have the appointment of one of the Clatsop members to NOHA, which I look forward to. Thank you.
Thank you, Commissioner Webb. And I know that LCTC has been working on that trail and planning for that. Commissioner Thompson, I think, had a comment to that.
So I'm eager, Commissioner Webb. I've been participating in those meetings for quite some time. I had to do something else today, so I wasn't there. I think the commissioners need to collaborate together and coordinate because I've been working with Andy on this and Jean-Paul Bowles and Commissioner Scar and others. So, and Dr. Doer and all kinds of other folks. So let's coordinate more closely so that we don't miss what each other is doing, because I think we'll have a better outcome if we can do that, please. And it's good that we're getting involved, but let's be coordinated involved. Thank you.
Yeah, thank you, Commissioner Thompson. Commissioner Tuyoka.
Good evening, everyone. Oh, my Commissioner Liaison, I had this big pre-planned thing, but for time's sake, I'll give you the Reader's Digest version. Excited about interviewing or just actually talking with the applicants for the Planning Commission. Just really excited about speeding up the process and getting 2 new members on the board so we can move forward with comp plan. Then a segue from comp plan, let's look at our strategic plan, the social services portion. A lot of my discussions, emails with constituents in this area is about the homeless issue. And I know I bring that up before, but I think the validity of the micro home sites, is timely here with the new planning commission and especially the social services portion of our strategic plan. We need to address that. These micro home sites, moving them away from public and business areas, having those services available on site, transportation available. Just as a little bit of an information, I did some extrapolation of data from federal and Oregon agencies like U.S. Interagency on Homelessness, Oregon Public Health Authority, looking at those data, and obviously it took some extrapolating, but 38% of our homeless population, alcohol problems, 26% alcohol drug related problems, 33% mental illness issues. So if you look at it, those are the services that we can provide on site at a micro home site. So instead of the Band-Aid principle of, shotgunning services, this would allow us to address homeless, alcohol, substance abuse, mental health issues all in one site. So as we proceed we're looking at ARPA funding, we're looking at all these different sources, excited about the possibilities of discussing these and, working into our strategic plan to find a solution for our county on these homeless issues. Not a Band-Aid, but a solution. Thank you.
Thank you, Commissioner Toyoka. I would just, from my report, I do have a CREST meeting tomorrow, CREST's meeting tomorrow. I did submit my application to the CCO, so I have yet to hear back about whether that's been approved. The press release I see that Commissioner Thompson sent me about the behavioral health monies. I do think that this is something that we do need to try to take advantage of, or at least see where we're at in the process. I know that here at Columbia Memorial Hospital, we have an excellent care management department, and they deal with, it's increasing demand on their services to deal with behavioral health and mental health issues. So I would be interested in following up on this. And I don't have anything else. I'll go ahead and turn it over to our county manager.
Chair Quaylen, members of the board, good evening. Just a few things real quickly. One, I just want to talk about the ARPA money, just generally speaking. When we've been in front of your board before, as you know, it's a multi-year funding window, and part of our strategy was to maintain flexibility so that as new or more firm proposals formed, that your board would have the flexibility to then appropriate resources. So as to the micro housing, that might be one of those opportunities, is that the flexibility that we created, if the opportunity meets community interest, that there are resources that would be available to help seed some of those efforts. Because as Commissioner Toyoka mentioned, I think, just from what we've seen in other communities, that is something that would provide some very needed housing quickly, but it also does provide the option of having those wraparound services on site. And there's some real advantages to that. The biggest challenge, as we all know, is always siting those facilities. And so that's where art meets science, I guess. So the other is that Ted McLean, our Public Works Director, had a meeting with the Corps where they went out and looked at some of the levies, and we're doing some just some background on what the actual current situation is with some of these levy districts, whether they're inactive, active, what's the status. If they are inactive, then obviously that responsibility then comes to the county, and we just need to understand what the lay of the land is with some currency. So we're just doing some of that initial diligence, but we'll be coming back to your board as we learn more. I know it's an important topic. The other is that we did just open up the public health director recruitment again, and so we took a pause during the holidays. We just opened it up again. We're actually producing a little video. I'm not saying that having my face on this video will make the quality any higher, but we're doing a little video where Margot and public health staff are also going to be really the primary communicators, just trying to show any potential applicants what public health is here in Clatsop County and what our values are and how we do the work that we do. So for entertainment purposes, in a couple weeks, you can probably take 5 minutes and watch that. And that's all that I have. Thank you.
I look forward to seeing that, County Manager. I do think, we have an excellent team here at Clatsop County, so I really do hope that we can recruit the right fit to that position. They have obviously big shoes to fill, but I'm optimistic that we're going to find that person and they're going to be able to step in and provide that leadership Thank you, County Manager. We'll move on now, finally, to the business agenda, as I skipped ahead earlier. We'll move on to item 11, which is the Clatsop County's American Rescue Act Plan Act funding agreement with Lifeboat Services, and that's on page 199. This was the item that was moved from our consent calendar for discussion.
Chair Coelho, members of the board, would you like me to give just a brief overview of the agenda item?
Yes, yes, please.
So this is a continuation of a conversation that began months ago. We came to your board, I think it was a couple weeks ago, Monica can correct me, with the initial slate of social service investments, and it really has addressed those core safety net functions that our residents use every day. Agencies like Helping Hands, the Harbor, Clatsop Community Action, and others. And so this is one that was going to go into that first slate of contracts, but we had to do some additional work with Lifeboat. As you know, this is a brand new organization. It has a couple of different tentacles to it, and it's also located in downtown. So as you know, there's been a lot of attention about its location and just some of the logistical challenges that they have had. And so what we have really focused on is a little bit different than the other contracts, which we're really focusing on maintenance and capital needs. This one does allow them to use it for some operating funds because they are a shoestring organization right now. And what we are trying to really help them do is to be viable, but to also help address some of these issues that they have been experiencing. And some of them are from, staffing shortages and just resource shortages. And so we want them to be successful, but we also want them to be a partner with the community that they are in. And so, so that's kind of what the focus is. I don't know if Monica wants to add anything more specific to that, but this is to help them get their feet underneath them, help the communities that they're serving, as well as hopefully help some of the neighborhood challenges that they have been experiencing.
Sure, I can just add, based on what Dawn said, a lot of the comments that have been coming from the Downtown Business Association is in regards to some of the concerns about behavior surrounding the area. And so, like Dawn mentioned, we did allow operational costs to be used with this so that they can hire staff to help monitor some of the activity that's happening around the businesses directly around them, the surrounding business areas, as well as still being able to provide capital to do some necessary upgrades for some of the things that they would like to be able to do. They would like, right now, they're operating during the daytime. They would like to be an emergency shelter, and they are installing showers so that way people will have a place to shower. They are currently also providing laundry services and a clothes closet, as well as job resource information and such. And so, so this will allow them to also help pay for some of those capital improvements, understanding that they even recognize that with their vision that they will outgrow this facility, in the next couple of years. And so the capital funds aren't to go towards the purchase of any real property, but towards capital improvements within the facility.
Any questions, comments? Commissioner Thomas.
Thank you, Mr. Chair. Thank you. I appreciate the explanation. I'm very much in support of emerging creative community responses to emerging community problems. And this problem has emerged. It's great that we are supporting the dealing with it. Again, what I'm looking at is to have some sense of the effort and the value produced, and looking for some kinds of data with all of these community organizations. Not a lot. How many people have you helped? How much time have you spent on them? Help us understand the value so that we can do the work we're supposed to do to assure that value has been produced. That's what I'm looking for.
And I can, oh, sorry, go ahead, Don.
Well, I was going to say, Commissioner Thompson, we appreciate that sentiment also, and certainly we will talk with Lifeboat about what some of those indicators might be in terms of the number of meals that they're serving, number of clients that are coming through the navigation portion of their center. We're just going to have to kind of work through that. As you know, right now, it is really a single person operation on the Lifeboat side. So, but we will work through that with some metrics.
And supportive, not constrictive or restrictive, really to support their work, but also for helping hands in the warming center and the harbor as well. I mean, what value are taxpayers getting for this? Help us see it so that we can share it and exercise our responsibilities.
Thank you. And we will follow up with the agencies. Thank you, Commissioner.
And I appreciate that we had the discussion about how, maybe addressing some of the issues that have come downtown with some of the neighboring businesses, and, whether that's security or longer hours or whatever that needs to happen. I think we'll have an opportunity to review that at some point and make sure that those issues have been addressed. When will be the first opportunity for us to do that, Don?
But I think that once we actually provide the initial resources, I think we will be in contact with them and just continually get updated on their progress. And obviously, there's a lot of feedback in the community, so we will have plenty of ears to the ground to help us figure out what is working and what might need some additional attention. So,
thank you, Commissioner Bang.
I just wanted to voice my agreement with Commissioner Toyoka's direction that he was taking in regards to potential future outcomes. Because I tend to agree, if we can find a centralized location where we can place services, where when issues arise, we can, if there's a place people can go to receive said services, I just feel like that concerted effort going in one direction, which is assistance and rehabilitation, be it whatever type of rehabilitation that it is, or just basic helping folks move through life. Being able to provide a centralized location in the future would also probably alleviate a lot of concerns that are currently facing our community right now in regards to the houseless situation. And so I just wanted to voice my support in the direction that he seems to be traveling with this thought process.
Thank you, Commissioner Banks. Commissioner Webb.
Yeah, this is very consistent with, I have already expressed to the county manager how terribly disappointed I was in our strategic planning session, and the last one that we did. And one of the issues for me, a couple of years ago, I thought when we did our first strategic plan, we had a very robust section about performance measurement. And I thought we were going to talk about it in terms of our own delivery of services, aligning our budget issues with performance measures. And there have been a couple of attempts in the staff's weekly reports that have shown me that our staff is not very well trained in understanding what the essence of performance measurement is. And a few weeks ago, I had someone approach me who is on the Human Services Advisory Group that has a very small amount of money that they give to social service organizations. And so she wanted me to give her from our budget the pass-through that of state money that we contract with CBH for. And it turned out to be a several week-long process of trying to find on one page what is the origin of funding for CBH, and to what extent that is our county money, and then what distinct programs does that pass through to support. And I couldn't agree more with Commissioner Thompson's suggestion that we need, when I see reports often from CBH, I always say to myself, well, you know, these folks are social workers. They're not performance measurement experts. And so I think we need to help the folks who we do fund. We need to help them become more proficient in performance measurement. And I think it's the kind of thing for 3 years, I've advocated for some kind of a dashboard for Clatsop County, something that we can do probably monthly reports about what's going on in the county, about what our services are supporting, etc. And there are ways of doing it. The science of performance measurement is very mature now. I've been working on it in government for the last 30 years, and a lot of people are doing it very well. So there are a lot of very good lessons out there. And I would love to see that be reintegrated into our strategic planning, because to me it's essential for our accountability for how we spend money. Thank you.
Thank you, Commissioner Webb. And Commissioner Thompson, just we are talking about lifeboat services on this one, and then we'll move on to the next item, which is CBH. Commissioner Thompson.
Thank you. I support Commissioner Webb's objective. I think we're in a developmental process. I think the workload thrown on us, dumped on us, raining on us from COVID has diverted a lot of time and attention and energy to fundamental human survival. And so while I'd like to see us moving in that direction, I understand what has delayed us in that regard, and that is a pandemic and all of the impacts on every aspect of daily life. So I'm interested and compassionately patient is what I would say to that. And then, Mr. Chair, if you're ready, are you ready for a motion?
Yes. Commissioner Toyoka has a comment first.
Sorry.
Oh, just one additional. I agree with the data. We need data support as we move forward. It's like the old, I was a Marine. The old Army guys were walking by and they go, "Where are you going?" "I don't know, but we're making good time." So we need the data to support if we are successful in our mission. Just saying, I think we also need data on our local businesses, or when you're looking at citing of those services, we have to look at the impact. Is there a positive or negative impact to the surrounding areas? The only thing I've heard about now is they're supportive of what they do, but the citing is not ideal for a lot of the businesses. It's a detractor. It's being addressed, but I think that's a metric we have to look at for the future. If they're looking at reciting, we have to look at those metrics as well. Thank you.
Thank you, Commissioner Toyoka. Are we ready for the motion?
Okie doke. I move that the board approve the attached American Rescue Plan Act funding agreement between Clatsop County and Lifeboat Services for a not to exceed amount of $35,000, authorizing the county manager to sign the agreement.
Second.
Moved and seconded to approve the attached American Rescue Plan Act funding agreement between Clatsop County and Lifeboat Services for a not to exceed amount of $35,000, authorizing the county manager to sign the agreement. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. Next item is the CBH provider agreement on page 233. And, do we have any comments from staff, or do we want to go right into commissioner discussion?
I don't,
Commissioner?
I'm
Go ahead.
sorry, I was just gonna say, I can speak to questions that might come up. Amanda is not here, but if you want to be more specific on what your questions are.
Commissioner Thompson, you in your hand.
I will. So really, I'm not looking for an onerous development of an additional layer of work and red tape for the providers. What I am looking for is on those program elements, either 38 or 42, if I read our packet correctly. I want to know the number of clients served and the number of hours of services provided. I think it's a beginning point. I think it's a reasonable way that we can gradually refine our communication over time so that we can look for accountability for the best value, the maximum impact on the whole environment, the directly affected population, because it's all part of our community. As Commissioner Toyoka points out, we all impact each other one way or another. So let's start looking at those broader pictures in a data supported way. And I think this is an important piece of it. I just wanted to put that point on the record. Thank you, colleagues.
Thank you, Commissioner Thompson. Any other comments on item CBH provider agreement? Any questions for staff? Any other discussion? Are we prepared to make a motion on this? I tend to agree with you, Commissioner Thompson. I think that we need to have more thorough reporting. Commissioner Webb.
I'm ready to make a motion. I move that the board approve the 2022 Clatsop Behavioral Health Care Provider Agreement. That's my motion.
Do we have a second?
Second.
Moved and seconded that the board approve the 2022 Clatsop Behavioral Healthcare Provider Agreement between Clatsop Behavioral Healthcare and Clatsop County with a not to exceed amount of $1,793,228.24, authorizing the county manager to sign the agreement and all subsequent agreements. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. Next is item 14, Northwest Oregon Housing Authority Board appointment on page 388. And do we have any staff report, Don?
Chair Coyle, members of the board, I'm happy to give a staff report real quick, but I didn't want to take the thunder away from Commissioner Webb if she would rather provide a quick overview. So.
Yeah, I'd be happy to do that. I have shared with you all the challenges that the NOHA organization has been faced with over the last couple of years. We had to separate our relationship with our former executive director because we were on the brink of being disaccredited by the Department of Housing and Urban Development, which is the main source of income for all of our assisted housing in Clatsop County. Not all of it, I'm sorry. We have other sources as well, but this is the mainstay. We hired a wonderful national consulting company that specializes basically in assisting the management of housing authorities throughout the country. And we were blessed with being given an interim executive director who's been working with us now for a year and a half. And we recently, the way that NOHA works is that it's a 3-county organization, Columbia, Clatsop, and Tillamook County, and each county appoints 3 people to the NOHA board, one of which must be a sitting county commissioner. We recently had Mel Jasmine, who is a Clatsop County long-term resident and public supporter and servant, has, for health reasons, resigned from the board. So we must now fill that position. I believe that the biggest challenge facing NOHA right now is our financial issues. We have been doing some very good contracted work over the past year under the guidance of our interim, where we have now understand much more fully what the condition is of all of our properties, what some of the management challenges are in running those properties. But it is primarily understanding the financial issues that is so important for board members. And it's extremely complicated. The funding streams are very diverse. And you know, this is an organization that does everything from you know, taking care of all of the mechanical issues in Owens Adair, all the way up to figuring out how to get more affordable housing built in our 3 counties. So it's, to me, the thing that we need most on the board right now is somebody who really, really understands the financial aspects of developing properties. And I believe that out of all of our applicants for this position, the person who most meets that need is David Oser. I don't know how many of you know David personally. I met him when he was a very important component of advocating for the Astoria School District's capital investment program, which was taken to citizens for a bond a couple of years ago. And he was a tremendous advocate and really rolled up his sleeves. And I don't think I ever went to a presentation about the bond measure that David wasn't very, very much a part of. He is a former executive of Craft 3, which is a nonprofit lender in the Pacific Northwest. And he understands the finance of developing properties. And he knows this community very, very well, has been here a long time, and has been a really very outstanding proponent of spending money wisely, and also of understanding what the community needs. So I would like to move to approve the resolution in order appointing David Oser to the NOAA Board of Directors for a 4-year term ending December 31st, 2025.
Second.
Moved and seconded to approve resolution in order appointing David Oser to the NOAA Board of Directors for a 4-year term ending December 31st, 2025. All those in favor signify with an aye.
Aye.
All those opposed? Okay, motion carries. Thank you, Commissioner Webb, and he's going to be an excellent addition to the board. That's all the items on the agenda. Do we have any items for the good of the order? I think we do. Commissioner Thompson, and then manager.
Sorry, just one thing. During the board meeting today, the meeting with Congresswoman Bonamici, Mayor Jones said the city of Astoria loses $27,000 a month providing childcare. Loses $27,000 a month. So this is not a model. Childcare in the regular market economy doesn't work. So I appreciate very much the work that Chair Quila and Commissioner Bangs are doing, given those economic realities and the challenges in providing an essential human services element of our community. Thank you.
Thank you, Commissioner Thompson. Yes, it certainly has been something that we're contending with, and it's a very complicated model that we're trying to find solutions for. County Manager.
Chair Quayla, members of the board, is just a little reminder that we do have an executive session right after the board meeting. So
Thank you, County Manager. And if we don't have any other items for the good of the order, I'll go ahead and read the executive session script. The County Board of Directors